Hello everyone and welcome to my Sister Wives Gossip. I hope everyone is having a wonderful day. Before we begin, please hit the subscribe button and give this video a thumbs up. Dr. Terry Dubrow talks Brandi Glanville's horrific face parasite claims. Brandi Glanville recently opened up about a change in her appearance. At the time, she shared her belief that she had been infected with the Moroccan parasite. Since the story came out, Dr. Terry Dubrow has also weighed in on the situation. Dr. Terry Dubrow has offered his surgical talents to a variety of reality shows. Dubrow is a plastic surgeon and a television personality. He'd appeared on The Swan and served as a co-host for shows like Botched by Nature, and Put at Work. Dubrow also has some history with the Real Housewives franchise. He and his wife Heather have appeared on The Real Housewives of Orange County. Fellow Real Housewives alum Brandi Glanville recently shared what she believes recently caused her face to change. According to The Real Housewives of Beverly Hills star, she suspects she might have been infected by a parasite after a trip to Morocco. Dubrow recently talked with TMZ over the story. As he shared, "I saw one of her interviews and I've seen the picture of her, the one where she is swollen, the one where she is really deflated with the irregular skin." He continued, "Here's the thing. Here's what Brandi really needs to focus on. And it's not her fault. It's her doctor's fault. Brandi needs a diagnosis." For his part, Dubrow doesn't believe parasites are to blame for Glanville's condition. As he noted, she has to figure out if there's a microorganism in there. He continued, "It's not going to be a parasite. It's not going to be something she ate. It's going to be from something that got into her bloodstream." The Botched star also offered his services if need be. Dubrow also emphasized the importance of getting help as soon as possible. As he put it, "She's like a ticking time bomb. Every minute that microorganism is allowed to stay in her skin and do potential damage, she could suffer worse for it. It could be more difficult to treat and she could form more scars and more nodules. So Brandi needs a diagnosis. She probably needs a surgical intervention to get a piece of tissue and figure out what's going on." However, should Glanville be unable to get the help she needs, Dubrow also offered his services. As he noted, "Brandi, if you can't get a diagnosis okay and you need help, the Botched doctors are here for you." Dr. Terry Dubrow has dealt with some of the most shocking and gruesome medical disasters on Botched, but even he admits that Brandi Glanville's recent health scare left him stunned. The former Real Housewives of Beverly Hills star recently went public with a jaw-dropping claim. A mysterious parasite infected her face, leading to swelling, pain, and a terrifying brush with disfigurement. Now, Dr. Dubrow is breaking his silence on the ordeal, and what he has to say paints a truly chilling picture. A cry for help. It started with an Instagram photo that sent fans into a frenzy. Brandi, once known for her sculpted cheekbones and signature pout, posted a swollen, nearly unrecognizable selfie from a hospital bed. Her caption, "I can't breathe. My face is melting, and no one knows what's wrong. Please say a prayer." The image went viral. Fans speculated about fillers gone wrong, an allergic reaction, or even a stroke. But according to Brandi, the real culprit was more sinister, a parasite. "I was traveling, and I woke up one morning with my face feeling weird," she told followers. "It started swelling, and then the pain set in. Doctors didn't know what it was, until someone suggested it might be parasitic. That's when she reached out to Dr. Terry Dubrow." Dr. Dubrow weighs in. In an exclusive interview, Dr. Dubrow described the moment he got the call. "Brandi has been on my radar for years. She's bold, outspoken, and not afraid to be real. When I heard she was in trouble, I didn't hesitate," he said. But even he wasn't prepared for what he found. When she came in, her face was massively swollen, red, and inflamed. At first glance, you might think it's an infection or a reaction to a cosmetic procedure, but she hadn't had anything done recently. Dr. Dubrow explained, "I immediately suspected something deeper. After ordering a battery of scans, biopsies, and consultations with infectious disease specialists, the results came back. We found evidence of a foreign organism burrowed in soft tissue under her cheekbone, he revealed. It's rare, but not unheard of. Some parasites can enter the skin through microscopic cuts, especially when traveling in humid rural areas. Dr. Dubrow says the scariest part wasn't just the diagnosis. It was the fact that it had gone undetected for weeks. The parasite had created a pocket of infection that her body was trying to wall off. But that led to fluid buildup, which is why her face looked the way it did. And the pain? That's because it was moving. Yes, parasites can migrate, he said, shaking his head. It was beyond anything I've seen in a cosmetic patient. While he remained professional, Dubrow admitted he felt emotional seeing someone suffer so badly. This wasn't about aesthetics anymore. This was about saving her face, maybe even her life. The risk of sepsis was real. If this had gotten to her bloodstream, we'd be having a very different conversation right now. The road to recovery. Dr. Dubrow assembled a dream team, a facial surgeon, a tropical disease expert, and a cosmetic dermatologist. Together, they devised a treatment plan that included surgical extraction, high-dose antiparasitic medication, and hyperbaric oxygen therapy. We had to be aggressive, he said, but we also had to preserve the integrity of her facial tissue. The surgery, performed under sedation, was a success, but not without complications. The parasite had caused some necrosis in the surrounding tissue, meaning we had to remove a small portion of dead skin, he explained. Luckily, Brandi's skin elasticity and underlying bone structure made reconstruction possible. Now, after weeks of antibiotics, careful monitoring, and facial rehabilitation, Brandi is on the mend, and Dr. Dubrow says she's a miracle. She's tough as nails. She never once broke down in the chair. She cracked jokes, even when her face was double its normal size. That kind of spirit, it matters in healing, he shared. It could happen to anyone. While Brandi's story may sound like something out of a horror movie, Dr. Dubrow warned that it's more common than people think. People travel internationally, go to spas, walk barefoot, or swim in natural bodies of water. All it takes is a microscopic entry point and the right organism, he cautioned. This isn't about cosmetic surgery. This is about understanding the risks we all face, especially with global travel and climate change increasing the spread of unfamiliar diseases. He says he hopes Brandi's openness will educate others. She could have kept this quiet, but instead she chose to share her story. That takes courage, he praised. By doing that, she's not just reclaiming her face, she's reclaiming control over her narrative. Brandi's side of the story. Brandi herself later posted a video, makeup-free and candid. I didn't want to scare anyone, but this was real. I thought I was dying. And the worst part, people were accusing me of having botched work or bad fillers. I hadn't had anything done in months, she said tearfully. She praised Dr. Dubrow and his team for believing her. People were saying it was all in my head, that I was exaggerating. But Dr. Dubrow didn't judge. He looked at me like a person, not a problem to solve, she shared. Now she's focused on healing and raising awareness. If something feels wrong, push for answers. Don't let anyone dismiss your pain. I did for too long, and I'm lucky it didn't cost me more, she warned. Dr. Dubrow's final word. Dr. Terry Dubrow is no stranger to trauma, drama, and tabloid attention, but he insists this case has stuck with him in a different way. As a plastic surgeon, you usually help people improve how they look. In Brandi's case, it was about keeping her alive. I'm proud of the outcome, but even prouder of how brave she was through it all. And as for whether this has changed how he views his job, absolutely, he said. Medicine isn't just about fixing, it's about listening, believing, and fighting for your patient. Brandi reminded me of that.